Welcome to MedMythBusters Part 1. I'm Rachel Deere with DKB Med. I'd like to introduce our esteemed faculty, Dr. Maria Isabel Esparza. Dr. Esparza is board certified in internal medicine, endocrinology, and metabolism and obesity. Before I turn it over to Dr. Esparza, a few housekeeping items. Dr. Esparza has no commercial relationships to disclose. This program is brought to you through the generous support of DKB Med and the Institute for Johns Hopkins Nursing. Our learning objective is describe the efficacy and safety of GLP-1 agonists or GLP-1 agonists to treat obesity. And now, Dr. Maria Isabel Esparza.
I'm Dr. Maria Isabel Esparza. So for our first myth, insurance does not cover GLP medication. This is not correct. Some insurances do cover GLP medications, especially for diabetes. But for obesity, these medications might not be covered. And this is very much employer dependent. And some of the employers that were paying for them for obesity have stopped paying for them because of the high demand. So this has changed, hopefully with Medicare approving for heart diseases, then other payers will follow suit. But at this time, it is very hard to get these medications paid for. The next myth is, after stopping GLP-1 medications, patients generally maintain their weight loss for up to 12 months. This is incorrect. So in step 1 trial, they saw that the patients that stopped the GLP-1 medications regained their weight. 2/3 of the patients regained the weight they lost in that first year. So it is very important to have a plan on how to either decrease the medication slowly and continue to implement changes so that the weight is maintained. So it is very important to have a multidisciplinary team, have other ways of making changes that are sustainable for you, especially following with knowledgeable providers that can help you integrate nutrition and behavioral changes. Next myth, nutritional counseling is not required for patients using GLP-1 medications. There are a lot of patients that are using these meds outside of diabetes and even without the requirements for obesity just to lose weight. This could lead to muscle loss and even worsening of some conditions such as disordered eating. It is very important that these medications are prescribed by knowledgeable providers and to have doctors monitor you closely so you can maximize the benefits while maintaining your health. It is very important to have a team, including a dietitian, hopefully even a behavioral specialist, therapist, psychologist that can help you make changes that you can sustain long term. Myth, GLP-1 medications commonly cause life-threatening GI side effects such as gastroparesis or bowel obstruction. We've been using these medications for more than 10 years for diabetes, and we have seen that they're very safe. They can decrease the motility of your intestines and your stomach, but generally for most patients that are taking the adequate doses, this does not cause significant gastroparesis or have caused bowel obstruction. Could be that with underlying GI issues, using these medications can worsen conditions, and it's very important that these are prescribed by knowledgeable providers. These are very safe. In the 5 years that I used them regularly, I had very rarely any issues with gastroparesis or bowel obstruction, but they do decrease the motility and they can cause nausea, vomiting, constipation. So it is very important to take the doses that are right for your body and to be monitored closely. Myth, similar weight loss can be achieved with appetite suppressants as with GLP-1s. That is incorrect. GLP-1s usually promote more weight loss than appetite suppressants such as phentermine or others that can be used as bupropion/naltrexone or phentermine with topiramate. With these medications, you can usually achieve 5 to 10% of weight loss, and with GLPs, you are able to achieve 15 to 30%, especially with the newer generations that have GLP, GIP function. So the GLP-1s cause higher weight loss than the appetite suppressants.
Thank you to Dr. Esparza for busting those myths about obesity. And be on the lookout for part 2 for MedMythBusters Obesity, where we tackle more myths. Thank you for watching. If you'd like to claim ANCC credit, please click the Claim Credit button to take the evaluation. Your thoughts and comments are important and help us develop additional education. For MedMythBusters, I'm Rachel Deere with DKB Med.